Hi everyone, welcome back to SG Doctor Wellness. My name is Dr. Chen Yiming. In the second episode of this STD series, I'll be sharing more on chlamydia infection. How much do you know about this number one STD in Singapore and America? How is it spread and how can you prevent it? What are the symptoms and what are the complications? If you're new to our channel, click on the subscribe button now. Chlamydia is a very common sexually transmitted infection that can infect both men and women. It is almost twice as common in women than men. In Singapore, it is the most common bacteria sexually transmitted disease. It is caused by this bacteria called Chlamydia trachomatis. You can get chlamydia by having vagina, anal, and oral sex. Infections can also occur when the partners share sex toys that have become contaminated with the bacteria. You can't, however, get chlamydia from kissing, hugging or holding hands, sharing food or drinks, and using a toilet after someone else. Chlamydia infections are very treatable and curable, and it is important to receive treatment as soon as possible to actually prevent serious complications. If left untreated, it can cause permanent damage to a woman's reproductive system, resulting in infertility. It also increases her chance of ectopic pregnancy in future, and this is actually a non-viable pregnancy that occurs outside of the womb. Chlamydia infection in pregnancy is also potentially dangerous. It can increase the risk of premature birth and stillbirth. Babies born to women with chlamydia can be infected in the eyes and the lungs when passing through the birth canal. Now, the biggest challenge to treatment remains in the diagnosis. Why so? Because chlamydia is actually called the silent infection. About 70% of ladies and 50% of men do not show symptoms. And even if there were symptoms, they would only show up weeks after the initial exposure. As a result, there is delayed diagnosis and uninterrupted rapid transmission from individuals to individuals because no symptoms equals no problem, right? Definitely wrong. When symptoms do occur in men, we may experience burning sensation when passing urine, discharge from the penis, increased frequency of urination, and even pain in the testicles. In females, they can present with painful sexual intercourse, abnormal vaginal discharge, abnormal intermenstrual vaginal bleeding, pelvic pain, pain on passing urine. You can, however, reduce your chance of catching this infection by being in a long-term monogamous relationship with your partner, using condoms the right way every time you have sex. The group of patients who are at higher risk of chlamydia infections include sexually active young individuals, and statistics shows that chlamydia are higher among younger people younger than 25 years old, gay and bisexual men, patients who have a history of STDs. Therefore, you should get yourself routinely tested even if you have no symptoms if you are a sexually active young adult or if you have had unprotected sex with casual partners or sexual workers. What sort of tests can we do to diagnose chlamydia infection? Firstly, a urine PCR test, and secondly, a swab test that can also be done from the affected area. When the diagnosis has been confirmed, it can then be treated with a course of antibiotics like doxycycline or azithromycin. It can be easily transmitted between sexual partners, so it is definitely advisable that your partner is tested and treated at the same time to avoid reinfections. It is important also to recognize that you may get repeated chlamydia infection in future, even if you have been treated and recovered fully this time round. Sexual activities should also cease until you have finished your medications and your sexual partner has also been treated. Now, in my practice, when I test someone for chlamydia infection, I would also encourage screening for the other sexually transmitted infections like gonorrhea, syphilis, HIV, and hepatitis B and C. Take note that having chlamydia infection can increase your risk of getting HIV. To watch my 4th video series on HIV, click on the link on your top right now. So thanks for staying till the end. Understand that chlamydia is a dangerous sexually transmitted infection as there are often no symptoms. The potential complications when left untreated can actually be far-reaching. So stay faithful and use your condoms properly. Subscribe, like and share. Stay tuned for next week's episode on syphilis. Till the next time, stay safe and stay healthy.